Hello, my name is Femi Ojo. I'm a pulmonologist at Lagos State University Teaching Hospital. Today, I'll be showing us how to use one of the devices for delivering asthma medications. This is called a metered dose inhaler. It comes in different colors. It can be used to deliver controller medication for preventing asthma crisis. It can also be used for delivering reliever medications for addressing asthma crisis. It is very important to know how to use the inhaler properly. To use the inhaler, the cap should be removed. Then shake the inhaler 2 to 3 times. Prime the inhaler with 2 puffs if you have not used it for 5 days or if you are using it for the first time. Take deep exhalation. Put the mouthpiece in between your lips and form a tight seal. Start to breathe in. Press the inhaler and continue to breathe in. Remove the inhaler. Hold your breath for 10 seconds. Gently exhale or breathe out. Close the inhaler with the cap. Gargle your mouth with water and spit it out.
My name is Dr. Peter Ubwane. I'm a consultant pediatrician at the Department of Pediatrics of the Lagos State University Teaching Hospital, Ikeja. I'll be talking about a dry powder inhaler, commonly known as Discuss. A dry powder inhaler contains medications in form of powder, and for a user to be able to use it effectively, it requires that it be inhaled maximally along with breathing in. We'll be demonstrating how to do this effectively. The first step before using a DPI is to open the mouthpiece. While holding the outer case in your hand, put the thumb of the other hand inside the thumb grip and push away. This will reveal the mouthpiece, which still has a diaphragm closed over it. To open this diaphragm, slide the lever away from you until you hear or feel a click. The inhaler is now ready to use. Hold the inhaler away from your mouth while you breathe out to empty your lungs while you prepare to breathe or inhale the medication. Hold your breath at the end of inhalation. Then put the mouthpiece into your mouth and close your lips around it. Breathe in steadily and deeply from the inhaler. Remove the inhaler, close your lips and hold your breath for 10 seconds or for as long as is comfortable for you. Then breathe out gently and rinse your mouth. Now we'll be talking about a spacer device or spacer. A spacer is a device that can be used along with an inhaler as it helps to optimize the amount of medication that is delivered to the lower airway. A spacer device traps the medication within the device so that the user can breathe it in more effectively than using just the inhaler alone. A spacer can be used along with an inhaler in 2 major ways. The first one is the tidal or multiple breathing technique, while the second technique is the single breath and hold technique. We first describe the tidal and multiple breathing technique. The first step is to take off the cap of the inhaler and hold it upright and be sure that there is nothing inside the mouthpiece. Then shake the inhaler well. and put the inhaler into the end of the spacer. Then put the mouthpiece of the spacer between your teeth and lips, ensuring that there is a tight seal. While sitting or standing upright and with your chin slightly tilted up, press the canister to release one puff of the medicine into the spacer. Breathe in and out slowly and steadily for about 5 to 6 times through the mouthpiece. Then remove the mouthpiece from your mouth and repeat the process for the number of puffs you are recommended to take. At the end of this, you can rinse your mouth. We now proceed to the single breath and hold technique. In the single breath and hold technique again, take off the cap and hold your inhaler upright and check that there is nothing inside the mouthpiece. Shake the inhaler well and put the inhaler into the end of the spacer. Then breathe out gently and slowly away from the inhaler and spacer until you feel that your lung is empty and you feel that you are ready to breathe in. Then put the mouthpiece of the spacer in your mouth and close your lips around it. While sitting or standing upright, slightly tilt your chin up. Then press the canister of the inhaler once and breathe in slowly and steadily until your lungs feel full. Remove the spacer from your mouth. Hold your breath for up to 10 seconds or for as long as you can comfortably do. Then breathe out gently. Repeat the process for the number of doses you have been recommended to take. Thereafter, you can rinse your mouth.
My name is Dr. Temitope Fakunda, a pulmonology resident at Lagos State University Teaching Hospital, LASUTH Ikeja. Today, I'm going to be teaching you about how to use a device called a peak flow meter. A peak flow meter is a device that measures how well your lungs can expel air. It's a device that is very important for individuals with asthma to own, as it helps to monitor how well controlled the individual is on treatment, and it also helps to warn in case of imminent attacks even before symptoms present. So it's important that every individual with asthma owns a peak flow meter and knows how to use it properly. Ensure the red marker is on 0. Attach the mouthpiece to the peak flow meter. Breathe in and out normally for a few seconds. Then take a deep breath and hold it in. Put the mouthpiece in your mouth in between the teeth with your lips forming a tight seal and holding the device straight. Blow all the air through the mouthpiece as hard and fast as you can. Take the measurement and write it down. Then you repeat the steps for 2 more readings and then you note the best recording.